am Dr. Sakina Davis.
Hi, I'm Lori Rhemann, physician assistant.
Today we're going to talk about hormone therapy for Wellness Wednesday.
So, can you tell me a little bit about hormones? What are some of the reasons that we would recommend for our guests to use bioidentical hormones?
So there's lots of reasons that we use hormones, and we're going to talk about both men and women. So for young women, we can actually start having some hormone issues even right at puberty. And so there's a condition that's called PCOS, which I happen to write just a small little book about called Unlocking the Mysteries of PCOS. And that is because I have this syndrome myself. So I felt like I wanted to relay some of the information of what this is. It's a syndrome called polycystic ovarian syndrome. And right around puberty, what happens is that you start to develop an imbalance of hormones. So you have an excess amount of testosterone for some women, normal amounts of estrogen, low levels of progesterone, so you don't ovulate correctly. So you have very irregular, heavy cycles, can have acne, can have hair growth in places that most women should not really have hair growth. So it's a very disturbing condition. And if you don't know what's going on, you really have no idea why these things are happening to you. A lot of young women start to gain weight at that time, and they don't understand why. And you see your friends eating all this great food, and you can't really eat all that pizza or whatever. And so it's really it's a really interesting syndrome of how this happens. So I wrote this to really try to explain to young women why this is happening to them, what we can do about it. So the great news is that there's a lot we can do about things like this. We can balance your progesterone using some natural supplements or natural bioidentical progesterone. We have natural supplements to reduce testosterone along with nutrition changes. So there's a lot we can do to correct and help this syndrome. For a little later in life, if we have, trying to get pregnant, so infertility issues can be partly related to hormone imbalance. So that's certainly something that we can look into right after having babies. The postpartum depression syndrome, we can look into areas for that. And then, of course, right before menopause, the years before menopause are called perimenopause. And then menopause, when you stop having a cycle for about a year. And so those years can be quite troublesome because, again, you can start having some really heavy cycles, trouble sleeping, you can have hot flashes, really get pretty moody and irritable before your cycles, and then some breast tenderness are some of the most common symptoms. So what we do is we look at, first of all, why are these happening? Are there some nutrition changes we can deal with? How can we address this with natural hormone therapy or supplements, and try to balance those so we can get you through all those stages in a much happier way. For men, of course, we start to see an imbalance of testosterone, and that can happen also at a young age. There are some men who have low levels of testosterone production even in their 20s. And then, of course, into their 40s and 50s, along with all the stress that we go through right now, we start to see some testosterone deficiency. So there's natural ways we can treat that. Again, especially if you're younger and still wanting to remain fertile, we have some recommendations, and then testosterone treatment for our men in their 40s, 50s who are not wanting to retain fertility. So we have a lot of ways we can look into that.
Can you explain the difference between bioidentical hormone versus traditional hormone replacement therapy?
Sure. So bioidentical means that it's compounded by a compounding pharmacy to match exactly the molecules of progesterone, estrogen, and testosterone that we have in our body versus something synthetic such as Prempro or Premarin. So Premarin comes from a pregnant horse urine. So last I looked, you're not a pregnant horse and I'm not a pregnant horse, so I don't know that I'd want to put that in my body. But if we're compounded to match exactly what we make, we usually use a wild yam base, or the pharmacy does, and then compound it to the different doses that we need. So we can start at whatever dose we'd like, increase it, adjust it. So the beauty of bioidentical hormones is we can adjust it to exactly what we need to individualize for each person.
Great. What forms or delivery methods are there for bioidentical hormones?
So there's many different forms. We can use topical creams, we can use oral capsules, we can use something called a troche that melts in your cheek. And then we have injectable forms, and we have pellets. So pellets are implanted in the flank area and can last anywhere from 3 to 6 months. And so again, we have to tailor it to each individual and what's most important for you, what's convenient for you, what are you going to use correctly, and what's best for each person.
So I do have a lot of guests that are concerned about whether or not they will develop breast cancer on bioidentical hormone replacement. Can you speak to that?
So absolutely. So again, we want to really work on individualized medicine. So we have some great testing that we offer in the office that's going to give us some genetic information. So if you have family history, we have some genetic testing that we can offer here to look and see if you carry BRCA1, BRCA2, or other genes associated to breast cancer. We have another genetic test that actually looks at how you metabolize your own hormones. So that tells me if you're at high risk or not based on how you personally genetically metabolize your hormones. We also have specialty testing that tells me how your hormones are metabolizing, so I can tell you if you're already at high risk, even on or off hormones, and then I can follow that very closely, or we can follow that very closely for each patient so we know exactly what your individual risk is going to be.
Okay. That is a lot of great information. There are a couple links that I think are going to be posted. Do you want to talk about this?
So right now we really urge you to please contact your congressmen and senators. We are going to post a link because we're trying to protect bioidentical hormones. So if you take them and you want to continue to take them, then I urge you to please contact your congressman and senator. We will post that link below, and please help us protect bioidentical hormones for you.
And then there is another link that will be posted for the Let's Get Candid podcast that is available after 5 p.m.
Yep, so it's truly a Wellness Wednesday. We're going to have a podcast that I was interviewed for by Let's Get Candid on Instagram, and we'll be talking a little bit more again about hormones and some of the other parts of my practice as well. So I hope you'll join us for that.
That was great information. Thanks, Dr. Davis, and thank you for tuning in today.